Okay, guys, so I'm talking about chapter 7. In this lecture, the chapter 7 is about the skeletal system. The skeletal system is divided into two different parts. One is axial, and the other one is appendicular. So chapter 8 is appendicular system, which is the limbs and girdles, so hip and shoulder girdles. So let's talk about a general introduction to the skeletal system. There is a few terms that you have to know. One is called articulation, which means the connection between the two bones. It doesn't mean that they are mobile, it just means the connection between the two bones. Then is the landmarks. Another name for that is called bony markings, and these are areas for attachments of the muscles and the ligaments. So it is some bony prominence is there. These are landmarks. Sometimes there are changes in the shape of the bone because some other structures pass through that. So that's how it is called. And foramina just means opening or holes, and usually nerves, blood vessels, and lymphatics pass through that. The function of the skeletal system. So axial skeletal, as I said before, there is also appendicular one. So let's leave the appendicular for now. Just talk about the axial. It is support of the different organs. So different organs in the body are attached to it, so that way it keeps it in that specific area. It protects vital organs. For example, brain is in the skull, is protecting that. Eye is in the orbital cavity or eye socket, so it's protecting the eyes. Ear is inside the bone, so it's also protecting the ear, inner ear I'm talking about. There's also heart, lungs, and great blood vessels in the chest. Trachea, esophagus is in the chest. Liver, kidneys, part of the stomach is also protected by the bones. And finally, there is pelvic organs that are there, like uterus, urinary bladder, rectum, and some other structures like ovaries are protected by the the skeletal muscle. I mean the skeletal bones. There is also attachment of different muscles. So the head muscles, especially the facial muscles, neck and trunk muscles are attached. It's important for movement of those areas. There is also muscles attached to the chest, and the movements of those muscles also cause movement of the bones and the joints in the chest area, and that's important for the respiratory function. And finally, appendicular skeleton attached to the axial skeleton, so the limbs and the girdles are attached to it, so that's for mobility. These are the bones of the axial skeleton. So skull is one of them. Then is the vertebral column. This is the vertebral column, which is made of the cervical area, the thoracic area. This is the posterior view, so you cannot see the anterior view very well, just this area. This is the lumbar area, so this is the lower back. The sacrum is here, and finally is the coccyx. So 5 different areas. Also the ribs are there, and the sternum. This bone is the breastbone. That's also called the sternum. So let's start with the skull. So skull divided into 3 different parts. One is the facial bone, the other one is cranial bone, and the last one is associated bones. So some of the cranial bones or facial bones are single, and some other ones are paired. It means that's one on each side. So when I talk about it, I will tell you which ones are paired or one on each side, and the other ones are unpaired, which means it is just a single one. So of the facial bones, so the nasal bone, this is paired, one on each side. Lacrimal bone, that is also paired. Maxilla is paired. Zygomatic bone is also paired. The one that are not paired means this is only one single one, is vomer and mandible, or lower jaw. The cranial bones, the frontal bone is paired. The frontal bone is not paired. Parietal bone is paired, and occipital bone is unpaired. So frontal unpaired, parietal is paired, occipital bone is not paired. Temporal bone is paired, one on each side, and the ethmoid bone and sphenoid bones, these two bones are not paired, they are just single. Associated bone, one is the hyoid bone. This is a single bone in the neck, different muscles attached to it. You will see the importance of that when we get to the chapter 11. And also there is auditory ossicles. Ossicle means small bones, and there is 3 of them on each side. So these bones are located inside the temporal bone. So this is the view of the skull. Easy to see it from the frontal view. You can divide it into 3 parts: the upper part, the middle part, and the lower part. So in the upper part, the main bone that you see, this is the frontal bone. This is the frontal bone. In the background, this one that you see, this is the parietal bone, okay, in the back. I will show you from a different view. It's easier to see it. Then in the middle, there's a lot of things are going on. So this is the orbital cavity. This is where eyes are located. Of the bones that in orbital cavity, one is the sphenoid bone. So sphenoid bone starts all the way from one side, it's covering the back of the orbital cavity, goes all the way to the other side. It is just a single bone. You also have some other bones like this one. This is called ethmoid bone. Ethmoid. So part of the ethmoid bone, you can see it here. Part of it, you can see it here in this area. So these are the ethmoid bones, okay? All 3 of them together. This is the nasal cavity, okay? Also some other bones that you see in the orbital cavity here. A small bone here, you can see this is the palatine bone. And this one is called the lacrimal bone, this one. And this area is not shown anything, it's not labeled, but this is part of this bone. This is the maxilla. Laterally, you can see the zygomatic bone. This is the cheekbone. And inside the nasal cavity, so you have this ethmoid bone in this area. This one is vomer, V-O-M-E-R, and this is called inferior nasal concha, one on each side. You have the upper jaw. This is the upper jaw. This is maxilla, and in the lower part, this is the lower jaw, and this is also the teeth are attached to the lower jaw, and that's called mandible. One terminology to know is called calvaria. So calvaria is frontal bone, parietal bone, and occipital bone together. For example, if there is any kind of surgery going on in the brain, so the surgeon can cut the skull like this. So they are removing calvaria. So that's the name comes from. There is also another term is called suture. So suture is a connection between the 2 bones in the skull. They are irregular in shape. This is like a sawtooth. There's a few sutures here. This is called coronal suture. If you go back to lab 1, you should know which plane is coronal suture. If you don't remember it, it's anterior and posterior. So separating the body to anterior, posterior section. So the coronal bone, the coronal suture is connecting the frontal bone and the parietal bone. And here is another bone here, the occipital bone all the way at the back, and the occipital bone is separated from the parietal bone by the lambdoid suture. So this is the lambdoid suture. And here is another bone. This is called the temporal bone. and the temporal bone is separated from parietal bone by the squamous suture. So you can see there's a lot of different structures are going on in the temporal bone, and when the time comes I'll come back to that. But one thing that is important here, because easier to see, it is this process is a bony projection. If you guys don't remember then these names, please go back to chapter 6. There is 2 slides that I told you to look at it. That is for terminology of bones, so please go back and read those 2 slides before reviewing this chapter. So this is the process. This is going and attaching to the zygomatic bone, so this is why this is called a zygomatic process, and that articulates with the process of the zygomatic bone, and that process is called the temporal process. So these 2 processes together, this is called the zygomatic arch. This is the orbital cavity that I was telling you, that is the eye is located there, and this is the ethmoid bone located medially. Anterior to that is the lacrimal bone. Anterior to that is the maxilla. This whole thing, this is the upper jaw, this is maxilla. And here is the nasal bone, which makes the upper part of the nasal cavity. And the lower part, here is the mandible, so that makes the lower jaw. From posterior view, you can see the occipital bone that is separated from the 2 parietal bones by the lambdoid suture. This is the lambdoid suture. And these are the parietal bones. There's 2 of them, and they are separated from each other by the sagittal suture. If you don't remember sagittal plane, go back to chapter 1, but as a reminder, sagittal plane is splitting the body into right and left. And look at the mandible at the background, okay? This is the superior view, so you can see the 2 parietal bones here. They are separating from each other by the sagittal suture. These 2 parietal bones are also separating from the frontal bone by the coronal suture, and from the occipital bone by the lambdoid suture. This is the inferior view of the skull, so there's a lot of structures are going on, so it's better to divide it. So this is the anterior part of it, so that way in the anterior part you can see the hard palate. This is the hard palate, and you can see that the anterior part of the hard palate is maxilla, and the posterior part of the hard palate is palatine bone. This hard palate is also making the roof of the mouth and the floor of the nasal cavity. So once again, the hard palate is making the roof of the mouth and the floor of the nasal cavity. So if you go a little bit lateral to that, then you can get the zygomatic bone. So here the maxilla is attached to the zygomatic bone. Going a little bit more posteriorly, now you can see that zygomatic bone is attached to the zygomatic process of the temporal bone. So this whole thing together is the zygomatic arch, both bones together. Okay, so medial to that you have this structure, and this bone is called the sphenoid. So this is just one bone from one side all the way to the other side. These structures that you see, these are called the pterygoid processes. So this is the medial pterygoid process, and this is the lateral, pterygoid process. Both the processes are the plural forms. And here in the middle you have only one bone here, and that's called vomer. Okay, one bone that makes the lower part of the nasal septum, lower part of the bony nasal septum. And this is also called, this one in the green, this is called nasal concha. There's 3 of the nasal conchae, so when the time comes I'll show you. Another structure actually to see in the sphenoid is this one, and this is called foramen ovale. Foramen ovale here, okay? And this red bone that here that you see on each side, this is the temporal bone. It has a lot of different structures there. This is the zygomatic process that I told you. This one is called the styloid process. This is sharp, and this is called the mastoid process. So there's 3 different processes in the temporal bone. Also, you have some foramen here. This is called the carotid canal, and the carotid artery passes through this. Carotid artery passes through the carotid canal. And here is that jugular foramen, and jugular vein pass through that. So the jugular foramen is located between the temporal bone and the occipital bone. Okay, between these 2 bones. You also here in the middle, you see this one, this is called foramen lacerum, and this foramen is located between sphenoid, temporal, and occipital bones. So there's 3 different bones. In the intersection of these 3 bones is foramen lacerum is located. In the back, this yellow bone that you see, this is occipital bone, and this area is called foramen magnum. So the big foramen or opening, and I have different images that I will show it to you later. This is the sagittal, mid-sagittal section of the skull, mid-sagittal. So this, you can see 3 different cavities here. This area, this whole big area that you see, this is the cranial cavity, and this is where brain is located. Then is another one, this is called the nasal cavity, and the third one is the oral cavity. So there's 3 different cavities are located here. Going back to the skull, so you can see anteriorly, this is the frontal bone, and that contains the frontal sinuses. That frontal bone is separated from the parietal bone by the coronal suture, and if you go all the way posteriorly, you have the occipital bone that is separated from the parietal bone by the lambdoid suture. This is the lambdoid suture. If you look at the floor of the skull, you can see the ethmoid bone. So this is ethmoid bone going posteriorly. This is the sphenoid bone, and going posteriorly, this is the temporal bone. So temporal bone makes part of the floor of the skull and also makes the lateral wall of the skull. The occipital bone here, you have some structures here, and this one is called the hypoglossal canal, this one. And this is again, this is the foramen magnum, this area, foramen magnum. Of the nasal cavity, if you talk about the nasal cavity, so this is the nasal bone that makes the anterior part of the nasal cavity. This is the frontal bone that makes the anterior and a little bit of the superior nasal cavity, this is the ethmoid bone. The ethmoid bone together with the vomer. So these 2 together, that makes then the bony part of the nasal septum. Bony part of nasal septum. Nasal septum is the it's like a wall that separates the nasal cavity into the right and left. And the superior part of the nasal cavity is also made by the sphenoid bone here. So 3 bones are making the superior part of the nasal cavity. What about the floor of the nasal cavity? I told you before, this is the hard palate. So this is the maxilla anteriorly and the palatine bone posteriorly. Also, there is the background that you see. This is the wall of the nasal cavity, but I will come back to that later. And this is the oral cavity. So the roof of the oral cavity is made by the hard palate, and also there is a soft palate there by muscles, but we are talking about the bones here, so I will not discuss that for now. It is the lateral wall partially is made by maxilla and also partially made by the mandible. So the lower part of the oral cavity does not have a bone. There are muscles and connective tissue around here. This is the superior view. So if you cut the skull horizontally, then this is the superior view of the skull. The skull inside, you can have it 3 different fossae. Fossa, F-O-S-S-A, means a cavity. Again, we go back to the chapter 6. Look at those 2 slides. So this is the anterior cranial fossa. This is the middle cranial fossa, and this one that you see, this is the posterior nasal fossa. So there is 3 of them together. Okay, so in the anterior nasal fossa, you have the frontal bone here, and also you have the ethmoid. The ethmoid, you can see 2 different structures here. One is a horizontal structure. This is called cribriform plate, and the other one is in the midline, this one, and this is called crista galli. So crista galli is perpendicular to the cribriform plate. Posterior to that, you have the sphenoid bone. Part of the sphenoid bone is for the anterior cranial cavity, and part of it is in the middle cranial cavity. So here you can see the different wings. This is the lesser wing, and this is the greater wing. It's like a bat, lesser and greater wing. Okay. You also have different foramen here. One is the first one is called foramen rotundum, and this is the first branch of the cranial nerve 5 passes through that. The second one is called the foramen. The second branch of the cranial nerve 5 passed through that, and foramen ovale, which is the third branch of the cranial nerve 5, passed through that. The first branch of cranial nerve 5 is passing through a different structure. It is around here, but it's difficult to see it. So it is around here, very close to foramen rotundum. And you also have the foramen spinosum, and these are some blood vessels that supply the meninges, pass through that. Meninges are a type of connective tissue that wraps around the brain, so we will discuss that in chapter 14. Here is the foramen lacerum. I told you before that is an area between the 3 different bones. Foramen lacerum, between the sphenoid, between occipital and temporal bone. And here is that auditory tube passed through that, and also part of the carotid artery passed through that, carotid artery. Here in the temporal bone, so one on each side here, and this thing that you see, this is internal acoustic meatus, and the cranial nerve 8 passed through that. And this is the jugular foramen, and you can see it's located between temporal and occipital bones. So here is the jugular vein passed through that. Also cranial nerve 9, 10, and 11 pass through jugular foramen. So lots of things. Then here is the occipital bone here, and this is the foramen magnum. Foramen magnum is an area that the brain ends and the spinal cord starts. Okay. And here that you see, this is the hypoglossal canal, which is the cranial nerve 12, passed through that, cranial nerve 12. So now individual bones. So my recommendation is that read the first few slides up to here very, very well, know it very, very well, in and out. Once you know those ones, then these other bones are a little bit easier, because that's a description of each bone in more detail, but at least you have to know where they are and some basic structures about each one. So this is the frontal bone. Okay, so this is the forehead area. This area, this is called the frontal suture. Why? Because initially the two frontal bones were separate and then they fused together in early childhood. And this flat area, this is called a frons. Glabella is a prominent area between the two eyebrows, above the nose between the two eyebrows. And this is a margin, this is called supraorbital. So supraorbital means above the orbit. This is the margin, and this is the notch. So notch is like half circle kind of structure, so sharper than the margin, okay? So this is a supraorbital notch. And if you look at it from the inferior to superior, going from bottom looking upward, this is making the roof of the orbital cavity, so making this area of the orbital cavity. In the middle you have the frontal sinus, and some people may get headache if they have sinusitis. And this is this area that you see, this is the margin, and here is the supraorbital notch, and above that is the foramen. So this is the foramen here. Somewhere here it should be, it's hard to see it in this one, it's like this and this. So it's a little bit different for everybody, the exact location, but this is the notch area, and for the supraorbital foramen is around this area, and then is the supraorbital margin. So there's three different structures in that area. And finally, this is the lacrimal fossa, and this is where lacrimal gland is located, lacrimal gland. Okay, so this is the parietal bone. There's two of them. This is located laterally and superiorly. See, laterally and superiorly. There's not much is going on there. This is a flat bone, and this here some lines here, which is difficult to see in this image. So one is here, one is here. This is different muscles attached to it, and they are called superior and inferior temporal lines. So anteriorly, the temporal, the parietal bone is attached to the frontal bone, and posteriorly is attached to the occipital bone, inferiorly attached to the temporal bone. The temporal bone, if you look at it, this is located laterally and inferiorly. So there's one on each side. It has two parts. One is the flat area. This flat area is called squamous, and this irregular area, the bottom, and that's called petrous. Petrous means a stone, so it's or a rock, so it's irregular in shape. You have different processes here. The one is called mastoid process. Again, if I ask you what mastoid means here, you have to go back to that chapter 6 and look at it. Mastoid usually means a round bony process, and this is the styloid process, and this is the zygomatic process that attaches to the zygomatic bone. And again, you can see the zygomatic process in the background here, and the mastoid process in the background here, and also the zygomatic at the background. So this is a better image to see these three different processes. Also, you can see external acoustic meatus, and this is where external ear is attached to it, and sounds pass through this area, and that goes to the middle ear, and from there it goes to the inner ear. The medial view does not have a lot of things going on here. The most important one is this one, and this is called internal acoustic meatus. This is where cranial nerve 8 leaves the temporal bone, and then it goes to the area, the lower part of the brain, that's called brain stem. So we will talk about that in chapter 14 when the time comes. So this is the sphenoid bone. It's just one bone, and you can see this is the location of the sphenoid bone. So I put these images back here again because you want to know where these bones are. So this is the area. There's two different views. One is the superior view, and this is this one that you see. This is the same view as this. So you can see some specific bony markings. One is the lesser wings. This is the lesser wing. Okay, this is the lesser wing, and this one is the greater wing. This is the greater wing. So lesser wing and the greater wing. Here, lesser wing, and this is the greater wing. In the middle that you see here, this is the optic canals, and this is the optic groove. This is where cranial nerve 2 pass through this area, cranial nerve 2. And in the background, the deeper area, the bone itself, this is called sella turcica. Sella turcica. And this is where pituitary gland is also located around here. Pituitary gland. There are 3 different foramen here. This is foramen rotundum. So the second branch of cranial nerve 2 pass through that. Foramen ovale. The third branch of cranial nerve 5 pass through that. This is the second branch of cranial nerve 5. And this is the third branch of cranial nerve 5 pass through that. And this is the cranial nerve 2 that passed through that through optic canal. And foramen spinosum. This is the one that I told you before that blood vessels of the meninges pass through that. If you look at in the anterior view, you can see in the middle, this is the body that contains the sphenoid sinus. So below this area, this is the sphenoid sinus, and this is one of the bones that has a sinus. If you remember it, frontal bone also had the sphenoid sinus. This is the lesser wing, and this is the greater wing. And the space between the two, this is called a fissure. So this is the superior orbital fissure, this and this. So structures that pass through the superior orbital fissure, it is a first branch of cranial nerve 5, also cranial nerve 3, cranial nerve 4, and cranial nerve 6 pass through that. Once again, cranial nerve 3, cranial nerve 4, first branch of cranial nerve 5, and cranial nerve 6 pass through that. This is the orbital cavity, part of the orbital cavity. So this is the background, the posterior part of the orbital cavity. This area that you see, this is the posterior part. You can still see the foramen rotundum, which was here. You can see it here. And this is the pterygoid plate that you cannot see it in this view, so you can see the inferior view of the skull. So this is this whole area is the process, and this flat area that you see, these are the plates. Okay, so medial and lateral plates. This whole area is the process. Okay, and this is the pterygoid muscles attached to pterygoid plates, and the pterygoid muscles are responsible for chewing. Ethmoid bone is just one bone. You can see part of this ethmoid bone around here. This is the superior view of the skull. Laterally, that you cannot see, then in this area you have the lateral mass, and that contains ethmoid labyrinth. Labyrinth is just the cavities, irregular cavities. So again, it has a sinus in this area, and then medially you have this flat area, and this is called the cribriform plate. So this area and this area, this is the cribriform plate, and this is where you can see this is the cribriform plate, and this is the cribriform plate. Also in this image, this is the cribriform plate, and this is the cribriform plate. The cribriform plate contains these holes, and these are called olfactory foramina. Olfactory foramina, which is the cranial nerve 1 pass through that. And here it's hard to see than this one. This is the crista galli. Okay, this is the crista galli here, and this image is this one. Okay, this is perpendicular to cribriform plate, and in this image will be in the midline. So this is the area that the meninge is attached to it. So if I look at the posterior view, so the one that you see, these are the lateral masses on the two sides, and this area makes the nasal cavity. So this is the nasal cavity. That's why I put the nasal cavity image there. So this one is the perpendicular plate, which is this. So this is part of the nasal septum, the upper part of the nasal septum. This is the lower part, this is vomer. This is the upper part, which is the perpendicular plate of the ethmoid. Also, you have these masses there, and these are called the superior nasal canker, and this is called the middle nasal canker. Middle, superior. Superior, you cannot see it here because it is covered by the nasal bone, but the middle, you can see that. This is called inferior nasal canker, and this is separate, a separate bone. It's not part of ethmoid. Once again, it is not part of the ethmoid bone. Okay, so occipital bone, this is the medial view, I mean the inner view of the occipital bone, and this is the outer view or external view of the occipital bone. Okay, so you can see a few different structures. The most important one that you see here, this is called foramen magnum, and as I said before, this area that is connecting lower part of the brain with spinal cord. Also, there is a couple of small openings are here, one here and one here. You cannot see it from this view. And this is hypoglossal canal, and that is cranial nerve 12 pass through that. You also have these ones, and these are called occipital condyles, and that articulates with the first cervical vertebra. First cervical vertebra. You have external occipital crest and external occipital protuberance. If you touch the back of your head, you may feel actually these areas. Also, you have some lines here. These are the nuchal lines. So one here and one here, and they are bony markings for the attachments of some of the neck muscles. Some of the neck muscles attached in that area. Maxilla is the upper jaw. Okay, so one on each side, so you can see the maxilla here. This is the anterolateral view. So it has a few different processes. This is called frontal process, and that attaches to the frontal bone. This is the zygomatic process, and that attaches to the zygomatic bone. And this area, this is called the alveolar process, and this is where the teeth attach to this area. There's the last process is called a palatine process, and that makes the anterior part of the hard palate. The posterior part of the hard palate is made by the palatine bone. So this is the palatine process of maxilla. This is the palatine bone. Also, you can see that the lower margin of the orbital rim, that is made by maxilla, and this is the floor of the orbital cavity that is made by maxilla. And this is a bony prominence here. This is called anterior nasal spine. There's also a posterior nasal spine, but it's hard to see it in this view. And this is the lateral wall of the nasal cavity, lateral wall of the nasal cavity. And this is part of the floor of the nasal cavity, which again, and this is the same thing here. This is the hard palate, which is the floor of the nasal cavity, or wall, or the roof of the mouth. And the background in this area, this is the sinus. So this is the maxillary sinus, which is just behind your cheek area, and sometimes it's inflamed by allergies or infection, and then you get facial pain. You'll also have infraorbital foramen, and the content of infraorbital foramen is the infraorbital arteries and nerves and veins, so all three of them together. Similar to the supraorbital foramen, that the content is with the same name, so supraorbital artery, nerve, and vein, same idea. Palatine bone does not have a lot of features. It has the horizontal plate, which is part of the hard palate, and this is the perpendicular plate, which is the part of the wall of the nasal cavity. Wall of nasal cavity. This is the part of the hard palate. And here is the called orbital process, and this is a small part of the orbital cavity. This is a small part of, very small. Mandible, this is the lower jaw. So if you look at around this area, this is the body. The body contains the mental foramen, and this is where the mental nerve and mental artery and vein pass through that, and mental protuberance. Okay, so this is the chin area. Also has a ramus. Ramus is a big bony prominence. Again, you go back to chapter 6 and look at those two slides. It also has a few processes. One is the anterior one. This is called the crinoid process. The second one is called condylar process. So this is the more posterior one. The area between the two processes is called mandibular notch. So notch is something like this, like a half moon or half circle shape. So the condylar process also has a head, and that articulates with the mandibular fossa of the temporal bone. So that will make temporomandibular joint. Okay. There's also an area here which is not that importance there. So there is another process that is there, and this is called the alveolar process. This area, this is the alveolar process that teeth are attached to it. It's not shown here somehow, but this is the alveolar process. Okay, so the lower teeth are attached there. And again, this is the crinoid process anterior. This is the condylar process posterior. And this is the mandibular notch. You also see this bony prominence, and that is called mylohyoid line. And the mylohyoid line is that mylohyoid muscle attached to it. And when we get to the muscle, chapter 11, I come back to this and discuss it. This is the mandibular foramen. And this is that branch of the cranial nerve 5 pass through that. So when you go to the dentist, they usually inject anesthetics so it can numb the branches of this nerve. So then you cannot feel pain during dental procedure. And also there is a depression here, and this is the submandibular gland is located. Submandibular gland is a salivary gland. Produces saliva during eating. Some other facial bone, one is the vomer. So that makes the lower part of the bony nasal cavity. The upper part is made by the perpendicular plate of ethmoid bone. You also have the lacrimal bone, and here is the lacrimal sulcus is located there. And finally is the inferior nasal concha that I showed you before, and that's a separate bone. And this whole area is the nasal septum, and as you can see, this is not straight, this is shifted to the side. So 2/3 of people actually have this problem, that their nasal septum is not straight, it's shifted to one side. This is the hyoid bone. It's just one single bone in the neck, and there's a lot of different muscles attached to it, and you can see that when we get to chapter 11. So it has a body, it has lesser horn, and it's a greater horn. At this time you may not see the importance of these, but in the muscle section you will see different muscles attached to those processes. And then now let's talk about the orbital complex. So they have different walls. The superior part of it is made by the frontal bone. So this is the frontal bone, and this is the supraorbital margin, this area, and this is the supraorbital notch. The posterior part is made by the sphenoid that contains a lot of structures. So one is the optic canal, that the optic nerve pass through that. This is the superior orbital fissure. and this is the inferior orbital fissure. Okay, you also have the lateral wall. So the lateral wall is made by the zygomatic bone, and the inferior wall that is made by the maxilla. Okay, you can also see infraorbital foramen here, and also infraorbital groove here, part of the maxilla. Medially, you can see the ethmoid bone that is located more posteriorly, and the lacrimal bone with the lacrimal sulcus and nasolacrimal canal. These two are part of the lacrimal bone that is located anterior to ethmoid. And finally, here is the maxilla that is located anterior to both of these. A small, very small part of the orbital cavity is the palatine bone, and you can go and compare these structures in this one. That is an actual bone. This is just a it's a colored images of that bone. So it's not the real life. You do not have colorful skull. So this one that I mentioned it before, so I come back to this. This is the part of the nasal cavity. So this is the midline or the mid-sagittal part of it. So that makes the perpendicular plate of the ethmoid bone. So one here, and this is the vomer, which makes the inferior part of the bony nasal septum. You can see the hard palate here made by the maxilla and palatine bone, and this is the upper part or the roof of the nasal cavity made by the frontal bone, ethmoid, and sphenoid bones. Okay, so this is in the mid-sagittal area. Let me explain this first, and then I come back to this. Okay, so this is the lateral wall of the nasal cavity, lateral one. The previous one was a mid-sagittal and midline. This is more lateral. So you can see here the lateral wall is made by the ethmoid bone. So this is the superior nasal concha. This is the inferior nasal concha. Both of them are part of the ethmoid bone, but here this one is inferior nasal concha, which is a separate bone. So there is these three concha on each side. So there is overall 6 nasal conchae, 3 on each side. You can also see this bone. This is the maxilla, the background. Maxilla makes the lateral wall and also the part of the hard palate. You have the nasal bone that makes the anterior and a little bit lateral part of the nasal cavity. This one that is not labeled, this is the lacrimal bone. If you want to write it, this is the lacrimal bone. And here is the lateral wall also made by the palatine bone. This is the palatine bone. So as you can see, the palatine bone makes the lateral wall and also part of the hard palate, which is the floor of the nasal cavity. And the sphenoid bone is making the roof of the posterior part of the nasal cavity. So come back to this image. This image actually shows the 4 paranasal sinuses. Okay, so one is the frontal sinus. This is in the frontal bone. This is the ethmoid sinus. So ethmoid sinus around here. The frontal sinus is this area, and the sphenoid sinus is this one, and finally the maxillary sinus that is around this area, inside the bone. You cannot see it properly here. So the reason for the sinus is that it contains air, so that air will reduce the weight of the skull, so that will reduce the pressure on the neck. Also is important for phonation. So if these are nasal if these cavities are filled, the sound actually changes a little bit. Fontanelles are areas of the skull that are still open. This happens in the very young child, and then within a couple of years, most of them close. So to understand the fontanelles, you have to look at the sutures. So fontanelles are located in the area between the sutures. So this is the coronal suture, and this is the squamous suture, intersection between the two that makes the sphenoid fontanel. And another one, this is the squamous suture, and this is the lambdoid suture, and the intersection between the two that makes it mastoid fontanel. So you can only see two fontanels clearly from the side view. This is the superior view, so you can see another two fontanels here. So one is the anterior fontanel that's located between the frontal suture, coronal suture, and the sagittal suture. This frontal suture that is initially open, later on fuse, and these two frontal bones become just one bone. And the anterior fontanel is the biggest fontanel in the skull. And the last one is called the posterior or occipital fontanel, and that's located between sagittal and lambdoid suture. So 4 different fontanels. The reason for that is the brain is growing, so this is why these bones are not fused initially, and once the brain, develops enough, and then they fuse, and by that time the bones also grow. So initially the growth of the brain is faster than the rate of bone development. So this is why it's open. If it fuses early, it will prevent growth of a brain, and that can be an issue. So you can go do surgery and actually break these sutures if they are fused. You can break it, so let the brain grow. Otherwise, it can cause mental retardation. The vertebral column, it is made of 5 different regions, okay? And there's also 2 different types of curves. So the region one, the first one is called cervical region, that's made of 7 vertebrae. The second is called the thoracic, which is made of 12 vertebrae. Third one is called lumbar, which is made of 5 vertebrae. And then is the sacral, which is the fusion of 5 vertebrae. And then is the coccygeal one, which is again a fusion of different vertebrae. It varies from one person to another person. There is also 2 different curves. One is the primary curve, and the second one is the secondary curve. So the primary curves are the one that you are born with it. Secondary curve is you have those curves later on during the development. So what are the primary curves? One is the thoracic curve. The second one is the sacral curve. These two, you are born with it. So the reason for these 2 curves is to increase area. Okay, increasing the cavity in those 2 areas. So these organs in those 2 areas can have more space. The cervical curves develops later as the child, sits and stands up. The weight of the head creates this curve, and also the position of the body in general. And finally, the lumbar one, once the child starts sitting and walking, this curve develops, and that's because of the weight of the head, neck, torso, and upper limbs are on the lumbar area. So there will be a lot of weight. So that causes a curve anteriorly. Vertebra is made of 3 different parts. One is the vertebral body, the other one is vertebral arch, and the third one is the articular process. They are a little bit different in each region, but in general, almost all vertebrae have these 3 features, almost all. Okay, so vertebral body is located anteriorly. Then is the vertebral arch, which is made of 2 parts. One is the pedicle. This is the pedicle. This area is the pedicle. And this area, this one that you see, not these ones, not this one, but the area, the background that you see, this is called lamina, L-A-M-I-N-A. So lamina is a flat area. So these 2 together, and that makes the vertebral arch. And between the vertebral arch and the vertebral body, you have an opening, and that's called vertebral foramen. Vertebral foramen, which is also this one. Then you have the processes. So this is a process, a bony projection. This one, this blue area that you see, this is called facet. Facet means a flat area. This is an articular surface. So you have transverse process. So there's two of them, one on each side. You have the superior or inferior. So it's difficult to see the superior one here, but you can see the superior one and the inferior one here. And finally, you have the, actually you can see the superior here, actually, yeah. And also you can see the spinous process, okay? You can spinous process that is only just one. So the transverse ones are two, the superior and inferior are two, but the spinous process is just one. And this area that you see, this is just a flat surface area that articulates with another vertebra, most likely another vertebra. Sometimes it articulates with another structure, but like for example, it can articulate with sacrum. So sacrum is a fusion of multiple vertebrae, but in general they articulate with another vertebra. Okay, so this is that multiple vertebrae on top of each other. So this is the vertebral body located anteriorly, and they are connected with each other by the intervertebral disc. Intervertebral disc here. This area is called the pedicle. This is the pedicle, and this area, this area that you see is a little bit hard to see it here. That's called lamina, but it's very easy to see it here. This flat area, that's called lamina. Okay. Then is the spinous process, which is this one. This is spinous process. The spinous process. Okay. So the area between the vertebral body and the vertebral arch. This was the vertebral arch. So the area, this area was called vertebral foramen. So if I go back here, this is the vertebral foramen. Okay. But when you put a vertebrae on top of each other, that creates another foramen. So this one is called intervertebral foramen. It means between the two vertebrae, intervertebral. Okay. So this is located around this area, and the content of the intervertebral foramen is the spinal nerve. Okay. Then you have multiple vertebrae. When they put them together, each one has vertebral foramen, and when you have many vertebral foramen together, that will make the vertebral canal, and the content of vertebral canal is a spinal cord. Okay, spinal cord. Now you see also these processes here. So you see these processes around here, and these processes have the facets. Okay, the facets part of the articular processes, and you can see that they fuse with each other. So the superior one will fuse with the inferior one. Inferior one here articulates with the superior one here. So different regions of the vertebrae. Now the cervical vertebrae. Cervical vertebrae C1, which is called atlas, and C2 is called axis. They are a little bit different than other vertebrae. C1 does not have the vertebral body here. It has an anterior arch and it has a posterior one. It also has these articular facets, and they articulate with the occipital condyle. Occipital condyle of the occipital bone. You also have the transverse ligament here, which I will come back to the transverse ligament. Okay, so the axis, this is the axis, and the C2, it has the vertebral body, and the vertebral body has this bony projection that's called dens of axis. So the dens of axis is located posterior to the anterior arch of C1. And also there is the transverse ligament that is located behind the dens. So these two, anterior arch and the transverse ligaments, prevents movement of the axis anterior posterior like this. It prevents that. Because if it moves, then it can damage the spinal cord. So that's why it is there. And some people, for example, people with rheumatoid arthritis, that area can be damaged, and then they can have pain and may even have paralysis. So now the rest of the cervical vertebrae. So you can look at the body. The body is small. You can see the vertebral foramen, so almost similar to that. This is the body located anteriorly. This is the pedicle, and this is the lamina, the flat area. This is the lamina, and this is the transverse process. Okay, it's a transverse process here, and the costal process, which you may not see it in all cervical vertebrae. And in between you have this opening that is called the transverse foramen. This is the transverse foramen, and the content of the transverse foramen is vertebral artery. Vertebral artery. You also have the spinous process, but you can see the spinal process is split here, and this is called bifid tip. Bifid. And you can see that this the upper edge is oblique and the inferior edge is horizontal. So these are a few features of the cervical vertebrae. And if you look at the thoracic vertebrae, they look like a giraffe. Do you guys like giraffe? I think it's a magnificent animal. I'm a little bit jealous of it because it is a little bit taller than me, but not much. Okay, so vertebral body located anteriorly. Okay, vertebral body contains specific articular facets here. This is called the superior costal facet. This inferior costal facet. Superior one, it articulates with the head of the superior rib. Okay, and the inferior one articulates with the head of the inferior rib. And this is the transverse process. This is the transverse process, and that also contains an articular facet. It's called transverse costal facet. This one and this one and this one, and this articulates with the tubercle of the superior rib. So superior rib, the head starts here, then is the neck area that does not articulate with the vertebra, and then is the tubercle, and then the ribs comes like that anteriorly like this. I will show this to you later once again. The vertebral foramen is now less than the vertebral body because there's more weight on the thoracic cavity, and because of that there's more pressure on the thoracic vertebrae. And look at the spinous process. Okay, so it's totally oblique and it's not bifid, so it's not split here. This is the lumbar vertebrae. It looks like a moose. You guys like moose? Okay, I hope you do. So here is the vertebral body, so big compared with the vertebral foramen. Why is that big? Because there's a lot of weight on the lumbar area. That's why it's so big. This is the pedicle. Okay, this is the pedicle, and this is the lamina, flat area. This is the lamina. It has the transverse processes, but does not have the costal facets. The body does not have the costal facets either. There's nothing there. There's no ribs here. Superior and inferior processes are there. Okay, superior and inferior processes are there. And look at the spinous process. Okay, it is horizontal, it is thick, and it is short. Sacrum is triangular in shape. This is the lower part is called the apex. The upper part is called the base. It has two surfaces, anterior and posterior. The anterior view, this flat area, this is called ala or wing. These bony prominence that you see These are actually the fusion of the vertebrae, so now it's ossified. These are called transverse lines or transverse ridges. Also, you can see laterally these openings are there. These are called sacral foramina. Sacral foramina contains spinal nerves. And posteriorly, if you look at it in the middle, this is the entrance of the sacral canal. This is the continuation of the vertebral canal. So the content of that is the spinal nerves. There's actually different names for it, but I will not give you that much detail or go into that much detail. It's actually part of the spinal nerves, but just right now know that the spinal fibers. Okay, and here these fibers are coming out or may enter the spinal cord. It depends on the type of the function that they have, and this area is called the sacral hiatus. There is also some bony prominence here that is in the middle. It's called the medial sacral crest, and laterally you have the lateral sacral crest. Different muscles and ligaments and tendons attached to that area. You have the sacral foramina similar to the anterior view. And also you have the sacral tuberosity, this area, and the articular process. So this articular process, this is the one that I told you before, that articulates with the L5, which is the lumbar vertebra, the last lumbar vertebra. Lower part of the sacrum also articulates with the coccyx, and as you can see, there's different vertebrae, they are fused together. This is the lateral view. So this is the base, and this is the tip of the sacrum is around here. And important clinically, this area is important. This is called sacral promontory. So what is the sacral promontory? Let me go back and show it to you again here. This is the sacral promontory. So it's located in the base. So if it is very anterior, that is not a good news for a woman, because during labor, the head of the baby cannot come down. So the vaginal delivery cannot happen, and the person has to have C-section. So it has to be a little bit backward. In men, it does not really matter, but in women, it's really important. This area that you see, this is called auricular surface. Auricular surface. And that is an area that is connecting with one of the hip bones. That's called ilium. And ilium is written with I. And I will come back to that on chapter 8. I will show you again the articulation. You can see this bony prominence a lot easier from the side view. So this is the median sacral crest, and this is the lateral sacral crest. Okay, and there is also the curve there. So this curve is not important in men, but again is more important in women. In men is more located anteriorly, but in women it should be like this. Okay, more inferiorly. If this is too anterior, then again the head of baby cannot come down, it's stuck here, and the person has to have surgery. This is a thoracic cage made of the 12 thoracic ribs or costal bones. Okay, these are 12 on each side, so there's 12 pairs. They are attached to this bone that's called the sternum. The sternum has 3 different parts. One is called manubrium. The second part is called the body, and the third part is called xiphoid. Xiphoid initially is a cartilage, and after age 40 ossifies and become a bone. The ribs are divided into 2 parts. One is called true ribs, which is rib 1 to 7. Why is that? Because each rib has its own cartilage. This is the cartilage that the rib comes and attached to the sternum. Okay, up to here. Then is the false rib, which is 8 to 12. False ribs are divided into two different types of ribs. One is called vertebrochondral ribs, vertebrochondral. So it's coming from the vertebrae. This is rib 8 to 10. So they come back and they fuse and they have only one cartilage here. So they do not have individual cartilages. They have just one cartilage, and that cartilage goes and attaches to the sternum. So this one is called vertebrochondral. That's part of the false ribs. And finally, this is the floating rib. Okay, so the floating rib, these are 11 and 12. You can see it easier from the posterior view. They do not have any cartilage. They are there in the back and they stay in the back. And they are protecting the kidney and the liver, but they do not come anterior. Let me explain the rib structure here in this image first, and then I come back to this one. So starting from here, this is the head of the the rib, and this is the articular surface that articulates with the vertebra. Then is the neck. This is the tubercle. This is the angle, and it comes into the body. And the body contains this depression. This is called a costal groove. The content of the costal groove is intercostal blood vessels and nerve. Intercostal blood vessels and nerves. This is anatomically really important and clinically important, because if you want to do any procedure in the chest, you have to cut it just above the superior part of the rib. Do not cut it here, because if you do it, you can damage the nerves or you can damage the blood vessels. So this is area that has to be damaged. It has to be cut. So if I go back to this image, you can see this is the articular facet of the head, and that articulates with the costal facet, the superior costal facet of the thoracic rib. Now this is the neck, which was this area, does not articulate with the vertebra, and then you have the tubercle, which goes back and articulates with the transverse costal facet of the rib. So once it's there, then it comes like this. So this is posterior, okay, this area is posterior. And then it comes back anterior. It does not allow me to show it to you all the way. It comes back here like this. And this is area that is the sternum is located in this area. So this is the tip of the body of the rib, and this contains a cartilage, and that cartilage connects with the sternum midline. And another rib around here, and comes like this all the way, and then it's a cartilage here, and then attaches to the sternum. And that's it. And if you have any question, please let me know. Thank you.